we'll do one thing. Raju, I'll try to increase the volume in the system. So, this trophoblastic changes. Here, on the 5th day of development, what happens is, 5th or 6th day of development, what happens is this glycoprotein coat, which is called as zona pellucida, will be eroded. And this developing embryo or zygote is ready for implantation. And already we have seen the process of implantation. So, during the process of implantation, what happens is, once the developing zygote will be implanted, here on the uterine wall, a fibrin plug will be formed and later it is converted into uterine epithelium. Already I said about this during implantation. So, once implantation starts and it is finished, meanwhile, simultaneously there will be changes which will be taking place in this developing embryo also. Like what happens is, in the area of this embryoblast, the trophoblastic cells will be differentiated into two layers, an outer layer and an inner layer. Here you can see this end is called as the embryoblast. So the trophoblast cells over here near the embryoblast, they differentiate into two layers, an outer layer and inner layer. These trophoblastic cells, which are differentiated into outer layer and inner layer, they have a name. Like the inner cells, they are called as cytotrophoblast, where I am focusing the cursor. See here, these ones. These are the cytotrophoblast cells. Whereas the outer cells, this bigger one, where I'm focusing the cursor. These outer cells, they are multinucleated and they are called as syncytiotrophoblast. Simple thing. We are seeing the changes in the trophoblast. The trophoblast cells, which are near the embryonic end, they differentiate into two layers, an outer layer and inner layer. The outer layer is called as syncytiotrophoblast, which has multinuclei, whereas the inner one is called as the cytotrophoblast. I think I'm clear for everyone. Now, with mitotic divisions occurring, the cytotrophoblast and cells migrate into syncytiotrophoblast. Here you can see the faded cells which are migrating into the syncytiotrophoblast. Now, in the process of development, next what happens is, now meanwhile the blastocyst is completely embedded into the uterine endometrium. Now, the trophoblast is characterized by lacuna. Here you can see these red spots. First, what happens is, in this syncytiotrophoblast, first small gaps appear. They are called as lacuna. These small gaps unite to form bigger gaps. These small gaps unite to form bigger gaps. And they are predominantly seen in the syncytiotrophoblast. And these growing gaps are called as lacuna. They are called as lacuna. What happens is, they are growing. So they invade this uterine endometrium and they erode the stroma of the endothelium of these maternal capillaries. And the blood will be poured into these gaps. And then this red color appears. Before that, they are hollow gaps, which are called as lacunae. As they are growing, they invade the uterine endometrium and they invade these uterine blood vessels and they erode the blood vessels. Once the maternal blood vessels are eroded, blood will be poured into these lacunar spaces, and the lacunar spaces are filled with this maternal blood. Hence, the uteroplacental circulation will be developed. Hence, the uteroplacental circulation will be developed. Now, here in this diagram, you can see the early stages in formation of chorionic villi, which will be seen on the 9th day. Like the points which I said just in the previous slides, in this diagram, you can clearly see them. Like here in the first diagram, you can see the extraembryonic mesoderm, above that the trophoblast, and this is the decidua. Now, in the developmental process, the trophoblast cells differentiates into two layers. See, cytotrophoblast and syncytiotrophoblast. Cytotrophoblast and syncytiotrophoblast. Now, in this syncytiotrophoblast, small lacunar spaces will be seen. These small lacunar spaces, they are hollow spaces. They unite to form bigger lacunar spaces. In this last diagram, you can see all these small lacunar spaces, they united to form bigger lacunar spaces. And as they are growing, they invade this decidua. They invade this decidua. Here in the, you can clearly see they are growing and they are growing towards the decidua. And once they invade this decidua, the maternal capillaries will be eroded. And the blood which is in this maternal capillaries of the decidua will be poured into this lacunar spaces. And uteroplacental circulation will be starting. Now, at this stage, the formation of chorionic villi also takes place. Like there are three types of chorionic villi: primary villi, secondary villi, and tertiary villi. We'll see how they are formed and at which stage we call it as a primary villus, and at which stage we call it as a secondary villus, and at which stage we call it as a tertiary villus. Now, as I said, this lacunar spaces will be growing and they will be invading this decidua. And the maternal bloods will be eroded, maternal blood vessels will be eroded, and they will be pouring this blood into this lacunar spaces. In this diagram, you can clearly see this lacunar spaces which are invading the decidua, and the blood will of this maternal side capillaries will be pouring into this lacunar spaces and they are filled. Now, formation of this primary villus, how it is formed, we'll see. On the day 13th or 14th of development, we see this primary villus. Only simple thing. Already I have said all these points that lacunar spaces will be developing, they will be invading this decidua and blood will be poured. Extra from that, only simple thing is the cytotrophoblast cells which are seen on the lower aspect of the syncytiotrophoblast, they invade into this trabeculae. They invade into this syncytiotrophoblast. And in a cut section, see this second diagram, in a cut section, it appears like this. And this stage is called as primary villus. So a primary villus consists of an outer syncytiotrophoblast and central core of cytotrophoblast, surrounded by maternal blood. Now, I think I'm clear for everyone. Trophoblastic changes. Again, I'm repeating from the starting of this class. Trophoblast cells. This trophoblast differentiates into two layers: outer syncytiotrophoblast and inner cytotrophoblast. Syncytiotrophoblast and inner cytotrophoblast. In the outer syncytiotrophoblast, what happens is small lacunar spaces develop. And these small lacunar spaces unite to form big lacunar spaces. And these lacunar spaces, as they are growing, they invade the decidua. Once they invade the decidua, what happens is the maternal blood vessels or the blood vessels of the mother will be eroded. Once the epithelium, the endothelium of this blood vessels is eroded, the blood from this maternal side will be poured into these lacunar spaces. And these lacunar spaces are filled with the maternal blood. Like this, the fetal and maternal or uteroplacental circulation starts. Simultaneously, this villi are formed at this stage. Like villi, they are divided into primary villus, secondary villus, and tertiary villus. Like coming to the primary villus. This primary villus is nothing but the below this syncytial trophoblast, we are seeing cytotrophoblast. The cytotrophoblastic cells invade the syncytial trophoblast. Here in the upper diagram, you can see it. Invade the syncytial trophoblast. So the second diagram is cut section, transverse section of this upper diagram. It appears like this. Like the primary villus consists of an outer core of syncytial trophoblast, and in the center we see core of cytotrophoblast. This is called as primary villus. It is seen on the 13th or 14th day of development. Further in the process of development, the secondary villus develops. This secondary villus is seen in the early third week. Here what happens is this lowermost one, like here in the primary villus, you are seeing this extra embryonic mesoderm in the lowermost part below the cytotrophoblast. Now it starts to invade into the cytotrophoblast. Here in this diagram, you can see it. This extra embryonic mesoderm, which is seen in the lower aspect, now it starts invading into the cytotrophoblast. Now, a transverse section or a cut section of this secondary villus, it appears like this. Secondary villus consists of an extra embryonic mesoderm lining the inner side of the trophoblast, which, or simply you can say, outer layer will be the syncytial trophoblast. Next, second layer will be the cytotrophoblast, and the innermost will be this extra embryonic mesoderm. Here in this cut section diagram, in the second diagram, you can clearly see this three things. The innermost is the extra embryonic mesoderm. Next, the middle one will be the cytotrophoblast, and outermost is this syncytial trophoblast. Just give me a minute. ఆన్లైన్ అని చెప్పాడండి. మీరు అక్కడ మీకు ఇబ్బంది 12 గంట వస్తుంటారు కదా, నాకు 5 minutes అవునండి. చేస్తాను, మీకు లింక్ ఇస్తాను, మీకు కాల్స్ లాగిన్ అవ్వచ్చు. మనతో సార్ చెప్తాను, అప్పుడు మీరు లాగిన్ అవ్వచ్చు. అడగచ్చు. ముఖ్యంగా ఉంచుతారన్నమాట. మ్యూచువల్ అండర్స్టాండింగ్ ఉంటుంది కదా. మధ్యాహ్నం నుంచి నాకు డిపార్ట్మెంట్ సిస్టమ్ పెడతాం, స్టడీ ల్యాబ్ లో సెటప్ పెడతాం. ఒకసారి ఉన్నారు అంటే మన దగ్గర ఉన్నారు స్టూడెంట్ ఆన్లైన్ అని చెప్పాడు. ఇక్కడ నేను స్పాటర్స్ పెట్టాను. స్పాటర్స్ అయిపోయాను. ఏం చేస్తారంటే మనం యూజువల్గా క్లాస్ లో 2 స్పెసిమన్స్ ఇచ్చేవాళ్ళం, కానీ ఒకటే చేస్తారు స్పెసిమన్. కట్ షాట్ చేస్తారు, ఎక్కువ ఎక్స్పోజర్ మనం అంత టైం ఎందుకు అని చెప్పి కట్ షాట్ అదొకటి, స్లైడ్ కూడా ఒకటే ఇస్తాను. ఆ 2 నేను అవగొట్టేస్తాను స్పాటర్ లో. ఇక ఓన్లీ వైవా మిగులుతుంది. ఆ వైవాకి ఏంటంటే సిస్టమ్ ముందు స్టూడెంట్ కూర్చోబెడతాను ఒకటి తర్వాత ఒకటి. ఏదో నామకాలు క్వశ్చన్ కొన్ని అడుగుతారు, పబ్లిక్ చేస్తారు, అది మొత్తం కంప్లీట్ చేసేస్తాం, అయిపోద్ది. నేను ఇది మార్క్స్ కూడా మీకు ఒక షీట్ పెడతానులేండి, ఇలా యూనివర్సిటీ నెంబర్లు వేసి ఆ షీట్ వాట్సాప్ పెడతాను, దాన్ని బట్టి మార్క్స్ వేసేసుకోవచ్చు అక్కడ. అలాగే అవి నాకు పెడితే సరిపోద్ది ఇలాగా. మళ్ళీ sorry for the disturbance. Like I got a phone from some examiner. I have to attend it as it is important. On Monday we are having this BDS University practical exam. Now coming to this point, secondary wellness. So only extra thing in this secondary wellness is the extra embryonic mesoderm, which is seen in the lower aspect in the primary vellus stage, will be invading this central core of this cytotrophoblast cells. So in a cut section, like in a cut section, when you see this secondary vellus consists of a central extra embryonic mesoderm covered with the cytotrophoblast cells, and the outermost layer will be this syncytiotrophoblast cells. This stage, the secondary vellus stage, is seen roughly around early third week. Now, coming to the next stage, tertiary vellus. So, before going to tertiary vellus, can anyone give me the summary of this lecture up to now? The changes in the trophoblast till now, what I said. Can anyone give me the summary? Am I audible for everyone? So now can anyone give me this summary? The outer trophoblast cells, they are divided into 2 layers. One is called as, inner one is called as cytotrophoblast, whereas the outer one is called as syncytiotrophoblast cells. So, syncytiotrophoblast. Here what happens is we see small lacunar spaces. These lacunar spaces further they unite to form bigger lacunar spaces. They invade this decidua, and the maternal blood vessels will be eroded. The blood of the maternal blood vessels will be poured into these lacunar spaces so that the uteroplacental circulation develops. The uteroplacental circulation develops. And next, the chorionic villi develops. Chorionic villi are divided into 3 villi: primary villus, secondary villus, and tertiary villus. Primary villus is into the syncytiotrophoblast. The innermost cytotrophoblast cells will be invaded, and the cut section here is like in a primary vellus, what we see is outer syncytiotrophoblast and inner cytotrophoblast. It is seen on day 13 or 14th of development. After that, we see the secondary vellus. Secondary vellus, how it is formed is the lowermost, this extra embryonic mesoderm now will be invading into this cytotrophoblast cells. So a cut section consists of 3 layers from outer to inner. Innermost is the extra embryonic mesoderm. Next, middle layer is the cytotrophoblast, whereas the outermost layer is the syncytiotrophoblast. This stage is called as secondary villus. It is seen on the third week of development. Now coming to the tertiary villus. Here in the tertiary villus, what happens is in this extra embryonic mesoderm, these capillaries develop and they invade the central core of this extra embryonic mesoderm. And now when we take a cut section of this, it is consisting of 4 layers. Observe that in this diagram. The innermost layer is the capillaries which developed in this extra embryonic mesoderm. Next is the extra embryonic mesoderm. Next is this cytotrophoblast cells. And finally, the outermost layer is the syncytiotrophoblast cells. This stage of development is called as tertiary villus. It is seen by the end of third week of development. It is seen by the end of third week of development. So this villi, they are divided into 3 types: primary villus, secondary villus, and tertiary villus. Primary villus is nothing but outer syncytiotrophoblast and central core of cytotrophoblast cells. Whereas secondary villus consists of 3 layers. Outermost is syncytiotrophoblast, second is this cytotrophoblast, and the third layer is this extra embryonic mesoderm. Now, tertiary villus consists of 4 layers. The outermost is syncytiotrophoblast, second layer is cytotrophoblast, third layer is this extra embryonic mesoderm, fourth is the blood vessels which developed in this extra embryonic mesoderm. So this is how the chorionic villi develop. Now, coming to the clinical application of this, like normal site of implantation, already you are aware of that. The normal site of implantation is the posterior most part of the fundus of the uterus. Sometimes we may see abnormal implantation of the placenta also, like a clinical condition called placenta previa. Here in this diagram, where I'm focusing the cursor, you can see the placenta. Usually normal placenta will be seen in the upper segment of the uterus, whereas in this abnormal types, we may see the placenta will be implanting other than the normal sites. Like first clinical condition called as placenta previa. Name itself is saying placenta previa. So when you are seeing or when you are trying to palpate or feel the head of the fetus through per vaginal examination or through the per vaginal examination through the cervical canal, first you will feel the placenta. The presenting part will be the placenta first. That clinical condition is called as placenta previa. Apart from this placenta previa, later when you're posted in your gynecology posting, when you're posted in your labor rooms, there they will show you these things. Like apart from this placenta previa, other types are also there. Partial placenta previa, this second diagram in the second row, you can see that partially covering the lower segment of the uterus. Marginal, another thing is marginal placenta previa. Like that, another thing is low-lying placenta previa. There are different types of this. Apart from this, another things. Apart from this, other things like extrauterine, these things, also called as ectopregnancy. Apart from this uterus, sometimes we may see these things like in the fallopian tubes or in the ovaries or in the abdominal cavities. So after this, coming to the embryoblast changes. Till now we have seen this trophoblastic changes. Simple thing. Trophoblastic changes, we see first trophoblast divides into 2 layers. What are they? What are they? Anyone? You can unmute your phone and you can say the answer. Trophoblast and syncytiotrophoblast. What are they?
Inner cytotrophoblast.
Here, Whereas I can see the messages like someone is speaking. Raju, ఒక్కసారి ఎలా రా? ఇక్కడ స్టూడెంట్లు మాట్లాడితే నాకేం వినిపించట్లేదు ఏంటి? వాళ్ళని క్వశ్చన్స్ కి ఆన్సర్స్ అడుగుతున్నప్పుడు వాళ్ళు చెప్తుంటే నాకేం వినిపించట్లా. So now can anyone say the answer? What are the trophoblastic changes seen?
Under cytoplasm and outer syncytial.
Okay, good. Trophoblast is divided into two layers. Inner is cytotrophoblast and outer is syncytiotrophoblast. Out of these two layers, syncytiotrophoblast and cytotrophoblast, which layer consists of multinuclei? Syncytiotrophoblast. So what are the changes we see in this syncytiotrophoblast?
Small lacunar spaces.
Small lacunar spaces are seen near the embryoblast end, and later this small lacunar spaces unite to form bigger lacunar spaces. And how uteroplacental circulation develops? How this uteroplacental circulation develops?
These lacuna erode into decidual maternal circulation.
Right. These lacunar spaces unite to form bigger lacunar spaces. As they are growing, they invade the decidua of the uterus, and the maternal capillaries will be eroded. And once the maternal capillaries are eroded, the blood from the maternal side will be poured into these lacunar spaces, and hence the uteroplacental circulation develops. And it is supported by this chorionic villi development. Now, how many types of chorionic villi are there? Three types. Primary, secondary, and tertiary. What is a primary villus? Primary villus consists of an outer syncytiotrophoblast invaded by cytotrophoblast. Now, what is secondary villus? How many layers are there in this?
3 layers.
3 layers. From outer to inner, what are they?
Syncytotrophoblast, cytotrophoblast, innermost extraembryonic.
Extraembryonic mesoderm. Now, what is tertiary villus? How many layers are there in this?
4 layers. 4 layers.
Four layers. Extra thing is only the blood vessels are developing in this. Now, those are the changes which are seen in the trophoblast. Simultaneously, when the changes are being occurred in the trophoblast, here in the embryoblast also, the changes occurs. Am I clear for everyone? We are seeing the changes in the trophoblast as well as changes in the embryoblast. For our understanding purpose, first I said about the changes in the trophoblast. Now I am starting the changes in the embryoblast. But these changes in the trophoblast as well as the embryoblast, they occur simultaneously. Am I clear? Now, we'll see the changes in the embryoblast now. Like the embryoblastic changes. Along with the changes in the trophoblast, the cells in the embryoblast also differentiate into 2 layers on the 8th day of development. Like the 2 layers which are differentiating are called as germ layers. They are the ectoderm and endoderm. On the 8th day of development, along with the changes in the trophoblast, we see changes in this embryoblast also. How the embryoblast is formed? How the embryoblast is formed?
Inner cell mass.
Right. Very good. This one, who is that? Chiranjeevi, 148. Very good. Inner cell mass forms this embryoblast, whereas outer cell mass forms trophoblast. We have seen the changes in the trophoblast till now. Like they develop into outer syncytiotrophoblast and inner cytotrophoblast, all we have seen. Along with them, this embryoblast is also changing. On the 8th day of development, this embryoblast differentiates into two layers. They are ectoderm and endoderm. They are the germ layers. Now, we'll see about these things. Already you are aware of this embryoblast. Some cells of this inner cell mass, that is the embryoblast, differentiate into flattened cells. In this diagram here where I am focusing the cursor, you can see them. The flat cells which are violet in color. So some cells of this inner cell mass, they differentiate into flattened cells. These flattened cells are called as endodermal cells, which are also called as hypoblast, which forms the first germ layer. So the first germ layer to develop is the endoderm. And the remaining cells of inner cell mass, they become columnar. Here you can see them. The columnar. They are called as ectoderm or epiblast. They are called as ectoderm or epiblast, which is the second germ layer to develop. Now, again I am repeating, the embryoblast changes. On the 8th day of development, along with the trophoblast cells, the inner cell mass, that is the embryoblast, also differentiates into two layers. One is endoderm, another is ectoderm. So the first germ layer to develop is endoderm. The first germ layer to develop is the endoderm, which will be flattened cells. The second germ layer to develop is ectoderm, which are columnar cells. Here clearly you can see them in the diagram. Now, between these two layers, a cavity or a gap will be formed. Between the ectoderm and endoderm, a small gap will be formed. And this gap is called as amniotic cavity. And it is filled with a fluid called amniotic fluid. At this stage, where we are seeing two layers, ectoderm and endoderm, at this stage, this embryo is called as bilaminar germ disc. Am I clear? So this roll number 40, Alfred Rahul, can you mute your cell phone? So, in this embryoblast changes, on the 8th day of development, we see changes in the embryoblast. We see two layers which are developing. One is ectoderm and another is endoderm. One are flattened cells and another are columnar cells. And in the process of development, a gap will be appeared between these two layers, the ectoderm and endoderm, and a cavity is formed. This cavity is called as amniotic cavity, where I am focusing the cursor on the diagram. Now, this amniotic cavity is filled with the fluid called as amniotic fluid. And at this stage, where we are seeing two germinal discs, it is called as bilaminar germinal disc or bilaminar germ disc. Now, further in the developmental process, when you observe this amniotic cavity, it consists of a roof as well as a floor. The roof is formed by amniogenic cells which are derived from this trophoblast. The roof of this amniotic cavity is formed by amniogenic cells which are derived from this trophoblast, whereas the floor is formed by this ectoderm or epiblast. The floor is formed by ectoderm or epiblast. Now, some flattened cells arise from this endoderm. Some flattened cells arise from this endoderm and they spread and line inside of the blastocyst. Here you can see in the diagram this yellow colored cells. They spread and line along the inside of the blastocyst. And these cells which are lining the inside of the blastocyst, they are called as Herzner's membrane. They are called as Herzner's membrane. Now, a cavity is formed over here and it is called as primary yolk sac. This cavity is called as primary yolk sac. Now the cells of trophoblast gives rise to a mass of cells which are called as extra embryonic mesoderm. The cells of this trophoblast, they give rise to a mass of cells which are called as extra embryonic mesoderm. This extra embryonic mesoderm is seen between the trophoblast cells and this Hausner's membrane. These cells, they lie between the trophoblast and this flattened endodermal cells which are called as Hausner's membrane. Now, the lining yolk sacs will be separating them from each other. These cells, they separate the wall of amniotic cavity from the trophoblast. These cells, what they do is they separate the wall of amniotic cavity from the trophoblast. And extra embryonic one, which lies outside the embryonic disc. The small cavities appear in extra embryonic mesoderm and gradually they join to form larger spaces and called as extra embryonic coelom. Here, now in this diagram, you can clearly see first this extra embryonic mesoderm is formed and small gaps will be appearing in this extra embryonic mesoderm, and these gaps unite to form a bigger space over here called as extra embryonic coelom. Now, extra embryonic mesoderm splits into two layers, an outer layer which is seen near this outer lining and an inner layer which is seen close to this developing embryo. Now, at this stage, it is divided into two layers. The outer layer is called as parietal or somatopleuric extra embryonic mesoderm, whereas the inner layer is called as visceral or splanchnopluric extra embryonic mesoderm. So at this stage, we are seeing two layers. This parietal or somatopleuric extra embryonic mesoderm, whereas the inner layer is called as visceral or splanchnopluric extra embryonic mesoderm. Now, when you observe this developing embryo, the extra embryonic coelom is spreading over here. See this blue colored one, it is spreading over here. And this developing embryo is having this amniotic cavity as well as this yolk sac. And this developing embryo is connected through this connecting stalk, which later develops into this umbilical cord. This extra embryonic coelom over here. This is the extra embryonic coelom which is seen over here. Like it has an outer layer. This is called as like in the previous diagram I said parietal layer, and this is having an inner layer called the visceral layer. Outer parietal layer and an inner visceral layers. And this developing embryo is connected through a connecting stalk, or later develops into this umbilical cord. Now, at this stage of development, two important membranes are formed. One is chorion and another is amnion. Chorion is the outer layer. Again, I am saying chorion is the outer layer which is formed by the trophoblast cells and this parietal or somatopleuric extra embryonic mesoderm. Whereas amnion, this is formed by the wall of the amniotic cavity plus visceral or splanchnopluric extra embryonic mesoderm. So, at this stage, we see two layers or two membranes which are formed. One is chorion and another is amnion. Chorion is nothing but the outer trophoblast cells with parietal layer or somatopleuric extra embryonic mesoderm is called as chorion. Here you can see that in the previous diagram. See here. You can clearly see this is the outer layer which is forming this chorion, in which you will see this chorionic villi, primary, secondary and tertiary chorionic villi already I said. You will see in this outer layer the chorion. Here, this is the chorion. Whereas amnion is the innermost layer. Amnion is formed by the wall of the amniotic cavity and this visceral or splachnopluric extraembryonic mesoderm. So up to this, we have completed the second week of development. In my next class, we will see about the third week of development. So we have, up to this, we have seen in the second week, like the changes in the trophoblast as well as changes in the embryoblast. The changes in the trophoblast are simple. Two layers are developed. One is say cytotrophoblast and another is syncytiotrophoblast. And this uteroplacental circulation develops and chorionic villi develops. Chorionic villi, they are divided into three types: primary villus, secondary villus, and tertiary villus. Now coming to changes in the embryoblast, again we have seen embryoblast dividing into two primary layers, this ectoderm and endoderm. At this stage, this embryo is called as bilaminar germ disc. Later, amniotic cavity is formed and yolk sac is formed. And later, extraembryonic mesoderm is formed, which is converted into coelom, and it has an outer layer and inner layer. Outer layer is called as parietal layer, and inner layer is called as visceral layer. And further, this parietal layer along with trophoblast is called as chorion. And this amniotic wall with visceral layer is called as amnion. We have seen the changes in trophoblast as well as embryoblast. So I will conclude my lecture today at this point, and in my next class we will see the changes in the third week of development. So it is a little lengthy class. Once open your embryology books and read about this thing with this fresh memory so that it will be helpful for you. Like because embryology, roughly around 15 marks in your university exam, they are asking roughly around 15 marks. So read these things, what I said today, it will be easier for you. And next thing, like already, if I'm not wrong, biochemistry HOD Dr. Banerjee sir, he announced about the internals, your first internals. Yes or no?
Yes, sir.
So your internals are starting on third. Third will be anatomy, and anatomy syllabus will be till today. Syllabus will be till today. Entire general anatomy, upper limb, thorax, whatever covered in embryology and histology. Till today, what we have covered, everything will be in your syllabus, and your exam starts by 9 o'clock. It is a 3 hours paper. Paper will be given in this site only. Exactly by 9 o'clock, I will be giving the paper. And it is a 3 hours paper. After completing that, you have to make a PDF folder and you have to send it to the department mail. For that folder, first keep your roll number and next write your name. It will be the folder's identity. First your roll number and next your name will be there for the folder. Am I clear for everyone? So Monday on 3rd by 9 o'clock, I will be giving you your first internal anatomy paper. You have to complete it within the stipulated period of 3 hours along with the diagrams wherever necessary, and you have to scan it and send it to the department mail. Already in previous exam you have sent to the same mail. So again on Monday I will focus that PowerPoint slide also where to send this mails, and grace period will be 1 hour. Like 9 to 12 exam will be there. 9 to 10, 10 to 11, 11 to 12. So 9 to 12, 3 hours exam will be there, and grace period will be up to 1 o'clock. Beyond 1 o'clock, I will not accept anyone's papers. Am I clear for everyone? And next thing is, just 1 week before we kept an exam and you people have sent them to the department mail. You people are 150 according to your roll numbers, and I received 185 mails. So don't send and resend your mails. So lot of mails are coming. Out of 150 people, I received 185 mails. So don't resend them. Simple thing. Scan your these things, all papers, convert it into a PDF folder, and for that folder, first keep your roll number, next your name, and send it to department mail. It will be convenient for us also. Easily we can identify by the roll number and name, and we'll correct them. So any doubts? In my next class, we'll see about this third week of development. Thank you. Raju?
Sir,
Thank you, sir.
hello.